often use the terms mesothelioma and asbestos cancer interchangeably. And while both are cancers caused by asbestos exposure, they're actually different diseases affecting different parts of the body. Understanding the distinction matters for diagnosis, treatment, prognosis, and legal claims. Today, I want to clarify exactly what mesothelioma is, what the other asbestos-related cancers are, how they differ, and why the terminology matters. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding these distinctions helps you interpret your diagnosis correctly. So let's start with the fundamental distinction. Mesothelioma is a specific type of cancer that develops in the mesothelium. The mesothelium is a thin protective lining around the cavities that hold the lungs, abdomen, heart, and testicles. Mesothelioma is almost always caused by asbestos exposure. By contrast, asbestos cancer is a broader term that includes mesothelioma, but also includes other cancers caused by exposure to asbestos. Lung cancer is the one most closely associated with mesothelioma, but there are other devastating cancers that have been linked to the toxic mineral, including cancers of the larynx, ovaries, and possibly other sites. So all mesotheliomas are asbestos cancers, but not all asbestos cancers are mesotheliomas. Think of it like this. All golden retrievers are dogs, but not all dogs are golden retrievers. The two cancers that are the most frequently confused with each other are pleural mesothelioma and asbestos-related lung cancer. Pleural mesothelioma develops in the pleura, which is the lining around the lung. Lung cancer develops in the lung tissue itself, in the airways, the air sacs, and the lung parenchyma. Under the microscope, these cancers look very different. Mesothelioma has characteristic cell patterns, and it stains positive for certain markers like calretin and WT1. Lung cancer, particularly adenocarcinoma, which can appear similar on imaging, stains differently. It's positive for some things and negative for mesothelioma markers. Now, before I go on, I want to take a quick break here to ask you a quick favor. If you find these videos helpful, hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. And if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, back to mesothelioma versus lung cancer. The causes do differ somewhat. Mesothelioma is almost exclusively caused by asbestos exposure, while lung cancer has multiple causes, with smoking being the primary one. It's responsible for about 80 to 90% of lung cancer cases. Asbestos exposure also causes lung cancer, and smokers who were exposed to asbestos have a dramatically increased risk that's 50 to 90 times higher than people who neither smoked nor were exposed to asbestos. Other lung cancer causes include radon exposure, air pollution, other occupational exposures, and genetic factors. Treatment approaches between the two cancers differ too. For mesothelioma, standard treatments are pemetrexed-based chemotherapy, immunotherapy with nivolumab or pembrolizumab combinations, and there are also surgical approaches like pleurectomy with decortication for pleural mesothelioma or cytoreductive surgery with HIPEC for peritoneal disease in selected cases. For lung cancer, treatment depends on the cell type and stage, but includes different chemotherapy regimens for mesothelioma. There are also targeted therapies against specific genetic mutations like EGFR or ALK, which are common in lung cancer but very rare in mesothelioma. There's immunotherapy that's similar to the treatment for mesothelioma in some cases, and lobectomy or pneumonectomy surgeries for localized disease. The prognosis differs significantly between the two diseases. Mesothelioma has an overall median survival of just 12 to 18 months, though peritoneal patients treated with surgery can achieve much longer survival. Cell type heavily influences these outcomes. Lung cancer prognosis varies enormously by stage and type. Early stage lung cancer can often be cured with surgery, while advanced lung cancer has a poor prognosis, but targeted therapies have dramatically improved outcomes for patients whose tumors have specific mutations. Why does the distinction matter legally? For asbestos lawsuits and trust fund claims, you need an accurate diagnosis. Mesothelioma claims are straightforward because asbestos is virtually the only cause. If you have mesothelioma, asbestos exposure is presumed, and your claim is strong. Lung cancer claims are more complex because smoking is the primary cause. If you have asbestos-related lung cancer and you smoked, any asbestos defendants that you name are going to argue that smoking caused your cancer, not asbestos. You might need medical experts to establish a significant contribution to your illness from your asbestos exposure. The bottom line, the burden of proof is higher for lung cancer than mesothelioma, and that can affect settlement amounts and the difficulty of winning the case. What about other asbestos-related cancers? Laryngeal cancer, which is cancer of the voice box, has been recognized as asbestos-related. The International Agency for Research on Cancer classifies asbestos as a cause of this disease. Ovarian cancer has sufficient evidence of asbestos causation, particularly from talc contaminated with asbestos, which has been the basis of recent high-profile lawsuits. Colorectal cancer, stomach cancer, and pharyngeal cancer have limited or suggestive evidence of asbestos links, but have not been definitively established as asbestos-related. Now, what about asbestosis versus mesothelioma? First, it's not a cancer. It's a non-malignant lung disease caused by asbestos exposure, where asbestos fibers cause scarring and stiffening of lung tissue, leading to chronic progressive breathlessness. Asbestosis can occur alongside mesothelioma or lung cancer. Having one does not prevent the other. Many patients have both asbestosis and mesothelioma. Treatment for asbestosis is supportive: oxygen, pulmonary rehabilitation, and treating symptoms. There's no cure, but it's not cancer, and it doesn't spread. Can you have both mesothelioma and lung cancer at the same time? Yes, though it's pretty uncommon. A patient might have pleural mesothelioma on the lung lining and a separate lung cancer in the lung tissue. This requires careful pathology to distinguish the two cancers, and treatment becomes very complex. How can you ensure accurate diagnosis that distinguishes mesothelioma from other asbestos cancers? Insist on getting an adequate tissue biopsy. Small needle biopsies sometimes don't provide enough material for a confident diagnosis. Require immunohistochemistry staining to distinguish mesothelioma from lung cancer and other cancers. Get an expert pathology review by a pathologist who specializes in mesothelioma. Community pathologists sometimes misclassify mesothelioma as lung cancer or vice versa. Make sure your medical team clearly states which specific cancer you have. Don't accept vague terminology like cancer in the chest from asbestos. Now, what if you were initially told you had lung cancer, but you have asbestos exposure, and the tumor appears to be on the pleura rather than in lung tissue? Request a pathology review specifically evaluating for mesothelioma. Sometimes the distinction isn't made initially and only becomes clear on expert review. This really matters because the treatment differs. You should receive mesothelioma-specific treatment if that's what you have. Why do people use the term asbestos cancer as shorthand for mesothelioma? Because mesothelioma is so strongly associated with asbestos. It's the signature asbestos cancer. When people hear someone has asbestos cancer, they often just assume it's mesothelioma. But using precise terminology prevents confusion and ensures you get appropriate treatment and legal representation. To review, mesothelioma is a cancer of the mesothelial lining that surrounds the lungs, abdomen, or heart, and it's almost exclusively caused by asbestos. While asbestos cancer is a broader term that includes mesothelioma, asbestos-related lung cancer, which forms in the lung tissue itself, and which is often linked to a history of smoking, laryngeal cancer, and ovarian cancer. Mesothelioma and lung cancer differ in their location, their appearance under the microscope, their treatment, and their prognosis. Accurate diagnosis with immunohistochemistry and expert pathology review is critical, and the legal implications differ. Mesothelioma claims are straightforward, while lung cancer claims face challenges, including assertions of smoking causation. Using precise terminology is important. You can visit mesothelioma.net for more detailed information about mesothelioma and other asbestos-related diseases, or call us 1-800-692-8608. We'll have you speaking directly to one of our patient advocates, or you can use the live chat feature on our website. As for me, remember to post your questions or comments below, and I'll see you next time.